Hello, and welcome to the Office of Special Education and Early Learning's first webinar for the 2020-2021 school year. My name is Sylvia Starkey, and I'm the Director of the Division of IDEA Monitoring and Results in the Office of Special Education and Early Learning. This is the first in a series of webinars that will be produced as schools reopen to both in-person and online instruction this school year. You can expect 4 more webinars to follow. Today, I'm going to be talking to you about telehealth and how it relates to the Family Educational Rights and Privacy Act, which we all call FERPA, and small group instruction for students with disabilities, particularly in related services, but it would also apply to other types of services as well, including small group instruction for things like resource. On August 31st, an email was sent to local directors of special education in Kentucky regarding some questions that we had received related to telehealth instruction. We have actually received lots of questions regarding the provision of related services via telehealth consultation. OSEEL has actually been in contact with the American Speech Language Hearing Association, which is called ASHA, to inform this update. And as future guidance from ASHA or the Office of Special Education Programs is shared, we will update our guidance and communicate with local districts as quickly as possible. We appreciate your questions, and we will continue to inform future guidance based on needs that are expressed from local school districts. Telehealth consultations are actually defined by KRS 205-510 number 15 as a medical or health consultation for purposes of patient diagnosis or treatment that requires the use of advanced telecommunications technology, which includes but is not limited to compressed digital interactive video, audio, or data transmission, clinical data transmission via computer imaging for teleradiology or telepathology, and other technology that facilitates access to healthcare services or medical specialty expertise. Telehealth is also defined in KRS 334A-200 as the use of interactive video, audio, or other electronic media to deliver healthcare. It includes the use of electronic media to deliver healthcare. It includes the use of electronic media for diagnosis, consultation, treatment, transfer of health or medical data, and continuing education. There's some points that it will be important for you to remember when you're discussing small groups and whether or not students can participate those while still maintaining the confidentiality that is required to protect their rights. So the most important thing that we have to remember when we're doing this is that regardless of the instructional delivery model, whether it's in-person instruction, a remote instruction, or some sort of hybrid, however your district may be going about that, local school districts do remain responsible for providing a free, appropriate public education, which is we call FAPE, to students with disabilities. That has not changed. The requirements from OSEP have not changed. There were no waivers granted by Congress to change any of the requirements for students with disabilities. So districts do remain responsible for providing FAPE, regardless of whatever model they choose to provide instruction in. The provision of related services via telehealth consultation during remote instruction is not only allowable, it's actually encouraged by both ASHA and OSEEL. We get lots and lots of questions about this. We have lots of people asking whether or not they're going to lose their licensures from ASHA based on providing telehealth consultations. Actually, when we talked to ASHA, we kind of both were able to agree that telehealth consultations allow related services to continue for students with disabilities, even when districts must close brick and mortar locations for whatever reasons, which would include the COVID-19 pandemic. Providing services via telehealth actually does not change the placement of a student with a disability. Rather, it's considered a change of location where those services are provided. So just because you move to remote instruction does not mean that the placement of your students has changed and that you would need to update the IEP. That is absolutely not necessary. You can continue to engage in online instruction without any new sort of requirements that needed to be happening. Additional consent is not required for students to participate in small group virtual instruction. This applies to both related services and general special education services. So you can do any small group virtual instruction without additional consent. The initial consent for the student to receive services is also applicable in the virtual setting. Some additional points that we'd like for you to consider is that telehealth consultations may be billed to Medicaid. There's actually some correspondence from the Department of Medicaid Services, and it states that the use of telehealth is actually encouraged when possible, and telehealth coverage and reimbursement requirements are outlined in 907 KAR 3170. The Office of Special Education, in early learning, we actually don't claim to be Medicaid experts. The best route for you to understand whether or not services are billable and exactly how those things work would be to contact the Department for Medicaid Services and walk through that with them. Group telehealth consultations are allowable. Again, that applies in both related services situations for things like occupational therapy, physical therapy, speech pathology, orientation and mobility services. It also would apply to a resource setting for students who don't have related services on their IEP, but typically maybe receive instruction from their teacher in a resource setting. In a small group, you could actually do virtual instruction for that as well. Um, and engaging in those group telehealth consultations does not automatically amount to a FERPA violation as long as the student's educational records or information contained therein is not disclosed during the session. It will be really important for you to discuss this with your teachers as they engage in those types of conversations. Just because a student is in a group instruction does not necessarily mean that you're breaking confidentiality. A really great way to think about it is exactly how it applies in a brick and mortar situation. So think about it if you were to walk past a classroom and see who was in that classroom when you looked through the window. It wouldn't necessarily become a breach of confidentiality because no record was provided which disclosed that that student had a disability. Another example would be if you drove past a bus and a student with a wheelchair was getting off the bus, you could deduce that that student had a disability because you could see it, but no one provided you with a record that stated that that was the case. And so there is no breach of confidentiality in those situations. So just like that, as long as you're not discussing what is contained in the student's IEP, you can engage in those consultations. It's important to remember that it's okay to work on skills that are within students' IEPs. The things that you're going to want to be cognizant of are just saying things like, okay, Johnny, in your IEP, it says, et cetera, et cetera. Just have teachers be mindful of their language as they're talking to make sure that there's no sort of breach happening. Um, Practitioners must act in good faith to protect the confidentiality of students during group telehealth consultations. Make sure that they're super careful not to disclose information in other students' educational records during a group setting. And I think that kind of goes back to what we just said. Just be very careful of your language and how you're presenting yourself within those consultations. We realize that there may be other parents around, and so you'll have to be very careful to make sure that you don't accidentally say something that somebody else would hear that would disclose something that was in their records. I think it will also be important for you to think through how you engage students within those things. There's some concerns about certain platforms and how they display student names. You will want to work with your Department for Technology to see if there's ways that you could work around those things. I've heard some creative solutions which included things like putting fake names in those smaller group instructions so that there was no way that anyone could print them out. As long as you're acting in good faith, you'll be able to kind of adjust to any sort of claims of disclosure. As long as you're doing your best to protect confidentiality, it would be appropriate to discuss with parents kind of some of the inherent things that are happening and just kind of ask them to help you to protect confidentiality. It's okay to remind parents to try and stay out of the room. There's not a need for Katie is not requiring any sort of hold harmless clause at this point. that parents have to sign off on. That's not required from KDE. And then the most important thing that you will really want to consider and really decide as a district how you move forward and make sure you communicate with your teachers is that when district staff record a small group virtual session, it does become an educational record. So districts must be very cautious when they're recording to prevent any potential FERPA violations. There's actually in the back of that in the links of that email, there's a really great document that was put out, and it goes through some of the things you'll have to think through. It's the very first link that's called Student Privacy and Special Education, an Educator's Guide During and After COVID-19. It was put out by some agencies, and it really does a great job of parsing out the things that you need to be thinking about before you record a session. I will tell you it is possible to record sessions without violating FERPA, but there are definitely some challenges that you'll have to think through. And because it's an educational record, it does become subject to all the FERPA protections that go with that. So just keep that in mind before you encourage any of your teachers to record sessions, and make sure they understand the implications that could be possible when they do record sessions. There are also some additional resources on there as well. The bottom two are things from ASHA that they actually provided to us. Things like their general telepractice resources. They have some checklists for school-based professionals to make sure that they are doing all the things necessary to provide a good faith effort. The last one, and I'm actually going to click on this link so that you can see it, is a guidance document. It's the one we were discussing with you earlier. And if you'll give me a second, I'm going to have to switch how we share the screen so that you can see it. It is actually this Student Privacy and Special Education and Educators Guide During and After COVID-19. When you look through it, it's actually an outside resource that was developed by the National Center for Learning Disabilities and the Future of Privacy Forum. And you'll see which laws kind of govern privacy concerns in special education. It does a really good job of leaning all those things out. You'll also see towards the bottom some of the things that are some question and answers to some of the most common questions that we get from districts about certain platforms and how to make sure they're compliant and the things that they need to consider. So we would, encourage districts to kind of read through this document and see what they can gain from that. Additionally, we just wanted to remind you that any ASHA members that are concerned about their telehealth consultations, I'll be honest, when I spoke with the compliance director for the state of Kentucky from ASHA, his name is actually Tim Boyd. He was very kind, and he was very excited that educators in Kentucky were so worried about ethics. I think in Kentucky, we, have a strong sense of ethics, and that's something that we should be proud of. And I think because we have that strong sense of ethics, there are some practitioners that are very concerned about their licensures and what the engaging in a small group telehealth consultation could do. Should you have any teachers or you be a teacher who's concerned about your licensure, we would really encourage you to reach out to Tim at ASHA or any of the other ASHA people for them to kind of help walk you through exactly the types of things that you need to be thinking of in order to maintain to be able to provide services via telehealth and still maintain your certification. ASHA's phone number is 1-800-498-2071. And like I said, you can contact ASHA with any kinds of concerns regarding certification. Additionally, you can contact me. Again, my name is Sylvia Starkey, and my phone number is 502-564-4970, extension 4118. You can also contact me at sylvia.starkey@education.ky.gov. So we hope this guidance really today helps you to understand the types of things that you need to be thinking through before you engage in a telehealth consultation. And like we said earlier, feel free to reach out if you have any questions, and we're happy to answer them. Again, you can expect additional webinars from the Office of Special Education and Early Learning to be forthcoming as the school year progresses. Thank you, and we hope you have a great day, a great week, and thanks for all you do to educate students with disabilities in the Commonwealth.